Joining us now from the Canadian Cancer Society is Donna Pachesnik. She is the manager of tobacco control. And that's what you know, Donna, is all of these regulations you've advocated over the years and pushed for stricter regulations when it comes to smoking tobacco. How does that set as a framework for what we're heading into next with smoking cannabis?
Well, our policy recommendations are consistent with our approach to electronic cigarettes and tobacco and any product that is smoked, and we believe government should look at that and the successful, extensive experience we have with tobacco when they move to regulate cannabis. So for example, age. We believe the age for purchasing cannabis as well as tobacco should be 21 for obvious reasons. It's more difficult for a 16, 17-year-old to purchase cannabis if the age is 21 versus 18. And many U.S. states are moving to 21 for tobacco, and we know the Saskatchewan public is supportive of that position. We just did some polling.
There is some suggestion, though, that in order to undercut that illicit market, that having a lower age might help better do that. You disagree?
Well, I believe that if, in fact, the objective of the provincial and federal governments is to prevent kids from purchasing cannabis, then the age should be higher than 18. At the very minimum, 19 in Saskatchewan, which is the age to purchase alcohol, but ideally we believe it should be 21. So does the Saskatchewan Medical Association, our doctors, so does the Lung Association, Heart and Stroke Foundation. In terms of where we allow marijuana smoking to happen, anywhere that bans smoking of tobacco should also ban the smoking of pot. Many municipalities are moving in that direction. They see it coming down the road, and it's become a bit of an impetus to take a look at their smoking regulations and make sure they're consistent with marijuana. So we got PA and Prince Albert currently looking at a bylaw that would include marijuana, electronic cigarettes, as well as other products that are smoked. The provincial government has fallen behind in this area. We haven't had any tobacco legislation since 2009. So this is an opportunity with cannabis to take a look at tobacco and cannabis and make sure it's consistent. We don't think, with respect to who should sell it, we think it should be a limited number of government-run establishments. Because
why government-run?
Well, we think that there's no profit incentive for government versus the private. And we see right now what's happening with tobacco and sales to minors. Retailers are selling to kids. So what will prevent cannabis retailers for selling to kids? We think the government can have a stronger control of that. We don't want to see retailers close to schools or other youth-oriented places. And we don't want to see cannabis alongside tobacco products or alcohol products, because we know that many people who smoke pot also smoke tobacco, and so we believe they should be separated, and I think other provinces recognize that as well as the federal government.
When it comes to health concerns around the use of marijuana, some people argue that, hey, this is prescribed for some people medically to help them feel better. So how do you explain why it's not something that you think is okay?
Well, medical marijuana is is separate from recreational marijuana, and so there isn't a ton of evidence around medical marijuana. We're seeing more and more as there's more interest around this area, but we're talking about recreational use.
But to a kid that would argue and say it should be okay, because we're seeing the statistics that a lot of kids are smoking pot.
Right. Well, most of the carcinogens that are in tobacco are also in marijuana. Every time you smoke something, there are carcinogens. Now, we don't know the long-term effects of smoking marijuana. We simply don't have the evidence to support that, but we know that many of the same toxins and poisons, chemicals in marijuana smoke are similar to tobacco. So we're saying we're concerned about youth and young adults, and we need to maybe, as Colorado has done, start with strong legislation. You can always pull back, but it's pretty hard to go the opposite way.
Thanks for your time today, Donna.
Thank you.